Dr. Dave, what an honor to have you here today and to be able to talk on a topic that I think is so helpful and relevant to people in this community. And as Penny said, you've done so much work within this space and with many different hats on: podcaster, author, president of the ATNS. But I wanted to talk to you specifically about your work with patients and the insights that you can share from supporting so many people to heal with the neuroplastic approach. And I know Penny said it's over 7,000 patients. That's just incredible. And, from personal experience of how life-changing recovery is, I multiply that by 7,000 and it's just mind-blowing.
Yeah, it was what kept me going in this work, which, when in the early days I had a lot to learn. I was, essentially a bumbling beginner. But even as a bumbling beginner, I was seeing people improve who had not been improving through their work with the rest of the healthcare system. And that was tremendously rewarding as a physician. And there was nobody else who was doing this kind of work. The patients were getting, as you all know very well, very frustrated with the rest of the healthcare system. And so I just kept doing it. And more and more patients were responding to these techniques. I learned more and more by having conversations with people and understanding how their lives, going all the way back to when they were children in most cases, had affected who they are as adults and what symptoms they were suffering from. And I just kept learning more and more, and people kept getting better. It ended up being about 1 out of every 3 of my patients. The other 2/3 was garden variety gastroenterology, that would structural problems and organ diseases. But for this group, I became the go-to person in my medical group, and people before long were sending me not only people with gastrointestinal symptoms, but with other symptoms from head to toe.
Wow. So could you speak a little bit about the breadth of different symptom types that you have seen successfully respond to the neuroplastic or mind-body approach over the years and the many people that you've successfully treated?
Yeah, I wouldn't want to take the whole half hour with listing all of the different symptoms, but I mean, it is essentially anything that is not linked to an organ disease or structural damage. So, migraines, tinnitus, which is ringing in the ears, visual disturbances, pseudo seizures, temporomandibular joint problems, difficulty swallowing, pain in the spine, anywhere from the top to the bottom of the spine, fibromyalgia, chronic fatigue, obviously, irritable bowel, pelvic pain, bladder spasms, genital symptoms, certain kinds of rashes, long COVID, um, joint pains, functional neurologic disorders, um, complex regional pain syndrome, just a huge, huge number. I've even had one patient who had a completely paralyzed stomach, not the abdomen, but the actual organ of digestion was, it has to um, contract in order to move stomach contents along, and in order to digest what's in the stomach, his stomach was not contracting at all. It was basically just completely paralyzed, and it was 100% from a neuroplastic condition. Another patient, abdominal pain unexplained for 79 years, successfully treated. The one with the paralyzed stomach, successfully treated. 17-year-old girl I was asked to see on her 70th day in the hospital, and she was getting morphine in massive doses around the clock, also successfully treated. But just shocking as a young doctor, just how ill you can get from what the brain is doing to the body.
Mm. Yeah, and I think it's encouraging for people to hear on this call who no doubt have lots of different types of chronic symptoms, just how broad that range of symptoms is that can be neuroplastic and that can respond well to the mind-body approach. So just coming to the topic of the discussion today, Dr. Clarke, in that vast experience of working with so many patients, how common is it to stall or to get stuck during that recovery process?
My patients, I would usually only see for a couple of visits. It was the nature of my practice, and I would send many of them off to get mental health treatment after we had identified the issues that were responsible. That was one of the big early problems, was that the kinds of psychosocial stresses that can make people physically ill are different in many ways than the issues that can make someone have mental health problems. And so the mental health community is not at the moment really well trained in how to identify the kinds of problems that make people physically ill. So it was my job to identify what those issues were, show people how they were connected to their physical symptoms, and then they would be able to have a conscious awareness of the problems that they needed to speak to a mental health professional about. And that tended to work much better. But there was a huge range about how long it took people to recover. You know, the very first story in that book that Penny mentioned, They Can't Find Anything Wrong, had a history of 60 admissions to a prestigious university hospital. She was cured in less than an hour, and they had no diagnosis after those 60 admissions. She saw a dozen specialists and a psychiatrist, and she basically tried to kick me out of the room. She said, "Don't waste your time with me. I've had all the tests. They never find anything." But less than an hour later, by knowing what to look for, she was pretty much cured on the spot. At the other end of the spectrum, some of my patients have needed years of psychotherapy to achieve a full recovery. So there's a lot of variation. The people who take the longest are typically people who are already taking opioid medication at the time they first come to see me. That usually points toward a more deeper rooted, longer lasting problem. But, in terms of percentages, Dr. Sarno used to talk about 5% would need psychotherapy of some duration. I've seen other people quote up to 30% that somewhere along the way in their recovery, it will stall. So it's quite a large number of people.
Yeah, and I think it's just really important to normalize that, isn't it? That if you are on your own recovery journey and you are feeling stuck or stalled, you can still recover. I think, as a group of recoveries, we know that we've all hit stalls along the way, and we got there in the end, and there is hope for recovery.
Yeah, and it's not anything to do with your own mental strength or resilience. It's all to do with the magnitude of the weight that you're carrying.
Mm-hmm. So just coming on to that, from your experience, are there particular, I guess, stages in the recovery process or particular situations in which people can get stuck or stall?
Yeah, I mean, there are stages, but it's not a great metaphor for when people are getting stuck. I mean, I think the metaphor that I like better is that the symptoms are a kind of language by which your mind is trying to communicate to you. And it's using your body because it is not able to use words. It's not able to communicate its sources of distress through conscious awareness. And when it can't do that, it's still trying to help you. It's still trying to let you know that it is in a state of distress, that there are um, issues from the past or present that are highly distressing for you. And it's letting you know this by inflicting physical symptoms on you. And the key is to try to understand what is being communicated. And the issues that are being communicated tend to fall into a relatively small number of categories. And they are um, usually, especially for people who've been having symptoms for longer than a year, there's usually a connection to a childhood experience. And sometimes the childhood experience is very obviously bad, that there was abuse, there was violence in the home, there was substance abuse by one or both parents, there was divorce or death or imprisonment or something of that nature that anybody would recall and say, yes, this was not a healthy thing to go through. But there are, a majority of people that didn't go through that. They went through something that was more difficult to recognize as being troubling, because none of us have a parallel life to compare ourselves with. We can't separate ourselves from our own personal experience and look at it objectively. We were just in the middle of it. It was how we lived our lives. And typically when people look back, they don't perceive uh, the level of difficulty that they were experiencing. And the kind of red flags that are telling me that there was a difficulty in the past fall into three areas: personality traits, triggers, and emotions. And the personality traits, I think, are familiar to most people. Dr. Sarno wrote about them. Dr. Schechter calls them the type T personality traits. And these are things like perfectionism and people pleasing and being extremely self-critical and devoting yourself so much to the needs of others that you fail to put yourself on the list of people you take care of. Being in unbalanced relationships where you are giving to a person who is you're in a close personal relationship with, but you're not getting the same back from that person. You're solving their problems, you're supporting them, you are focused on their needs, you are trying to keep them from going into distress, but it's not being given back to you. Another one is not taking time for your own joy. Many of my patients are living lifestyles as if on a treadmill that they never step off. They are, constantly working on behalf of their spouse, their family, their workplace colleagues, their neighbors, their social organizations, and their friends. And you ask them, what do you do for yourself? What do you do for your own enjoyment? What do you do for fun? And they're kind of like, well, not so much. And if you're living that kind of lifestyle, then sooner or later your body is going to protest. And there are a number of other of those personality traits: not being assertive, um, being very critical of yourself when you make a mistake, much more critical of yourself than you would be of somebody else who made a mistake or made the same mistake. Then the triggers are people, situations, or events that are highly stressful for you because they have a link in some way to a childhood experience. And this can be, almost anything. That very first patient in my book was triggered by her abusive mother, and she had no idea that her abusive mother was triggering her. But it was very clear in speaking with her that that's exactly what was going on. And it also, ironically, um, can be a positive event in your life, a new mutually supportive relationship, some kind of life affirming event in your life can be triggering simply because it is in such contrast with the past. So many of my patients have what I call the good partner, bad illness syndrome, where they become ill, ironically, when they meet the love of their life for the first time and they form that relationship. And they're just like, imposter syndrome raises its head, that do I really deserve this wonderful person in my life? And are they going to wake up one day and recognize that I'm a worthless human being and move on? So there's that fear. But there's also the recognition that, if this person who is so positive towards me has a point, that I actually am worthy of their support and affection, then it means that everything bad I went through as a kid was not deserved. And that stirs up a lot of resentment and anger. And if you learned as a kid to keep those negative emotions buried, you're going to keep on burying them as an adult. So when your wonderful partner is stirring things up, you'll have the emotions, but you won't be consciously aware of them. And emotions always have a physical component to them. So in this case, you have the physical component, but you don't know why. And that makes you worried about what in the world is going on in your body, which causes fear, which causes more symptoms. And then finally, and the most difficult, are the emotions. Many of my patients remind me of dormant volcanoes on the outside, but have boiling magma of emotions on the inside. Typically, the negative ones, of course, the anger, fear, shame, grief, guilt, which sometimes will burst out for little or no reason. Other times they're so buried they never show themselves, except manifesting in the body. And identifying the reasons for those can be very challenging. I've had, even with all the experience I've had, I can have a conversation with somebody where they're telling me, my childhood really wasn't bad. My parents cared about me. Maybe there were a few things that went on, but other people have been through much worse and they seem to be fine. So people are not recognizing the magnitude of what they were carrying as kids. So there's a couple of things that I do there, and this is challenging for even experienced neuroplastic professionals, to try to recognize and help patients recognize what happened. But one question I'll ask is, well, imagine your own child growing up exactly as you did. Many of you have heard me say this before, but imagine you are a butterfly on the wall of your childhood home, and you are watching a child of your own um, growing up in that environment, and you can't do anything about it because you're just a butterfly on the wall. You just have to watch. And let's say you're watching your kid try to cope for a week or so. What's that going to be like for you? Are you going to have emotions of sadness or anger as you watch? And if you are, that really helps people connect with some of these buried emotions, that they can't feel it for themselves, but they can absolutely feel it for a child that they care about. But I've also had patients who say, nope, I would be okay with it, watching a child of my own grow up. And um, so I'll put some kind of different spins on it. I'll ask people, well, what if I took control of your mind and I forced you to raise your child exactly the way you were raised? Would there be anything that would be troubling to you about that? And sometimes people will recognize that yes, there were some things that they would never do, and that can help us find a way into a greater understanding of the burden that they're carrying. And then the most difficult ones are, they'll say no even to that. But if they've got the personality traits, if they've got the some of the triggers, then I know that there's something. I mean, these issues do not happen out of nowhere. It takes something very powerful in a person's life to produce this, and to help somebody overcome when their progress has stalled. I need to find out what that is. Patient I spoke to a couple of months ago, patient from Europe, and we went through all of these stages of trying to understand, and she had all the personality traits and the physical symptoms and some of the triggers, and was insisting that her childhood was fine. And eventually I asked her, was there anything even the slightest bit troubling that you can think of? And she said, well, my parents used to fight with each other just verbally and emotionally. There was no physical violence, from time to time. And I said, okay, um, um, what kind of arguments, how serious were they? And it turned out that they were quite serious. They would be yelling and screaming at each other. And at the end, typically, the father would storm out of the house, threaten never to come back, and would sleep somewhere else that night. And I said, well, how often is that happening? And it turned out to be 3 times a month for 15 years.
Wow.
And she was the oldest child, and she tried to be the peacemaker, and she failed 3 times a month at being the peacemaker, and just starting at about age 4 or 5, and that hammering on your self-esteem is very commonly a starting point for neuroplastic symptoms in the adult years.
Mhm.
So I'll stop there. Long-winded answer, but this is the most complicated question for me, and teaching psychologists, the most complicated question to answer.
Thank you. That was incredible. So just to summarize there are a few things that you would advise people to explore if they are feeling like they're stuck and not making as much progress as they would like to. One would be the impact of childhood experiences, anything that caused them potentially to feel unsafe or that they would not want a child that they love to experience. Another would be personality traits that can place pressure on the nervous system and I guess signal danger in some way into the brain. Another one would be triggers, so things in people's lives that could be triggering them. And then another you spoke about was joy. And I think it's really easy to underestimate the importance of this, because when we're sort of doing the work of recovery, we can be very focused on that, on doing our practices, on learning more about the neuroscience, and it's really easy to forget the power of joy and what a powerful message it can send to the nervous system when we enjoy ourselves. Could you just speak a little to that?
Yeah, and all of these things that we're talking about, when you understand where they came from, it greatly facilitates overcoming them. And one of the ideas that I like people to absorb is that if you went, once you understand how much you went through, once you have an accurate sense of how much you had to overcome as a kid, then you can give yourself credit for that. You can understand that your early years resembled parachuting into the Amazon jungle as a toddler and having to find your way out. And you can give yourself tremendous credit for the heroic perseverance that's needed to do something like that. And when you do that, it makes it a lot easier to take time for your own joy. If you are growing up with the sense that your value as a person is dependent on how much time and effort you give to others, then you're not going to feel good about just focusing on your own needs. But once you recognize that you did a tremendous thing as a kid, it makes it a lot easier to say, you know what, I deserve to be on my list of people I take care of, and to take regular time for activities that have no purpose but your own joy, that are the moral equivalent of finger paints for a 4-year-old, that you're just doing it for yourself. And it helps you to be less tolerant of toxic relationships. If you have a good internal feeling about your own quality as a person, toxic people just don't seem as worth the time anymore. And it also helps, if you're in a toxic relationship, many of my patients have ended those after they've acquired this new self-image. And their next relationship after that is qualitatively much, much better than the ones they've had before. They're much more able to feel their own emotions, because they, have a sense that, if there's an emotion in there, they deserve to have it. Emotions are not right or wrong, they just are. And once you accept that, then you can feel them, and those emotions are a tremendous signal to help guide your life in positive ways.
Mm-hmm. And are there particular practices or tools that you recommend to help people get in touch with those emotions? Because I know it can be a really difficult thing if you're somebody who habitually suppresses emotions and really doesn't understand the impact of that, to tap into those emotions, to find ways to safely express them and process them. How would you advise people do that?
Yeah, I like people to start with that butterfly on the wall exercise, imagining a child of their own or a child they care about growing up exactly as they did. That helps people connect with uh, emotions about somebody else going through that, and that more naturally and easily then translates into connecting with your own emotions. And once that has happened, you can start putting them into words, either speaking them to a therapist or writing them down in a journal. One of the exercises that's helped a lot of my patients is writing a letter to the parent or parents who mistreated them, not to mail it, just to write it, and put down all the good stuff too. If you had some positive aspects to the relationship, absolutely put that in there. You want to have it be a full accounting, both the positive and the negative. And the more of those emotions you put down onto a page or speak to a therapist, the less those emotions need to be expressed via your body in the form of symptoms. One of my patients took the letter he'd written to his father's grave and read it to him. And he said it took him 4 or 5 hours to read the whole thing, and that by the end he was shouting. But after he did that, his physical symptoms were 90% improved the next day.
Gosh, that's incredible. And I would love to add to that I love to do emotional embodiment processes like the Tara Brach RAIN process, where you feel your emotions in the body and let them process through there. And there are many beautiful practices that you can find that allow you to get in touch with your emotions physically as well.
Yep, there are lots of different ways, and everybody's different. So what works for one person won't necessarily work for another, but the um, the general pathway, the general principles of what we're trying to connect with are very similar.
Mhm. I also wanted to talk to you, Dr. Dave, about doubt, and I think this can arise at any point in the journey. Particularly though, if you have experienced a setback or a stall, and you feel like you're doing everything right, doing all the practices and the learning, but you're still stalled, and then I think it's easy to get sort of drawn back down a rabbit hole of doubt and fear and start to think, oh, actually, is there something physical that's been missed, or is this new physical treatment that I've heard of going to be helpful for me? And yeah, just to really get drawn back into that. And then obviously the fear is the lifeblood of these neuroplastic symptoms. So how would you help people in this situation who are experiencing doubt, and that is preventing them from making further progress?
Yeah, well, my colleague and fellow board member Dan Ratner has just come out with a book this year called Crushing Doubt. So that's a good resource. But it's also reassuring to know that when you visit a physician for the first time with a new symptom, you have about a 40% chance that it's neuroplastic. Just before you've even seen the physician, just sitting there in their waiting area of their surgery, you're at 40%. After they've done their diagnostic tests to evaluate you, and those tests are negative, then your chances of it being neuroplastic are over 90%. And if you then are able to identify sources of stress and work on those, address those, and you notice that you are starting to improve just from doing that, then the proportion of it being neuroplastic goes even higher. So that's tremendously reassuring that you're in well over 90% at that point chance of it being neuroplastic, and probably in the at least 98 to 99% range. If you develop a new symptom, or if a symptom that you've had becomes qualitatively different or much worse, there's no harm in going back to the physician and reporting that and seeing if they wish to do any additional testing. You can also are very welcome to ask the physician, do you think it would be helpful for me to work on stress issues in my life? Many physicians are reluctant to bring that up because they're afraid the patient will throw them out of the room. But if you bring it up and they say, yes, I would encourage you to do that, that's also very reassuring. And you can go back with some renewed confidence there.
Mm. Thank you so much. And I also wanted to talk to you about conditioned responses, because a number of people mentioned this when they signed up for the event. And it's something that I personally experienced where, I was a long way into my recovery and doing really very well. And during the day, I would mostly be symptom free. And, that is life changing just in itself. But then at night, like clockwork, symptoms would arise and be very severe. And I think, I knew it was a conditioned response. There was nothing else that would really explain why this was happening. But it was a very stubborn conditioned response. It was difficult to overcome. And I know this can happen with lots of different triggers, like particular foods or drinks or movements or activities, places that we come to associate with fear and with the symptoms. So for people who are in that situation, as a number of people are who signed up for this event, would you have any particular advice around conditioned responses?
Yeah, it's always going to be a form of communication from your mind that there is still something that it's not fully happy with, that there's something that is still causing distress. And my patients who've reached the highest level of their healing, life being what it is, they still experience challenges from time to time. And at some of those times, their body is communicating to them that they are in a state of distress. But they can now use these symptoms as a signal to look at what's happening in their life and try to understand what it is that's distressing. People with neuroplastic conditions have become very skilled at taking their uh, distress from the ups and downs of life and stuffing it somewhere. And when you have mostly healed from this condition, you can unstuff them. You can use the physical symptoms to as an indication that you need to look for where is the stress that's going on right now? Where is that coming from? And maybe it's that your home and the whole family has just descended on the household, and um, they are causing distress for you at that moment. And but once you understand where the stress is coming from, then you can take steps to do something about it. And maybe it's just something as simple as um, this is one evening a week when I am not going to be at home when everybody gets home. I am going to go off somewhere else, and I'm going to go for a walk, or I'm going to go take a piano lesson, as one of my patients did. But something that is just for you to directly counteract what your body is communicating.
Thank you, Dr. Clarke. That's great advice. And I know it's time soon to move on to the next session, the next part of the session, where we'll be hearing from recoveries who've overcome stores themselves. But just before we do that, is there anything else that you would like to share on the topic of overcoming those stores in the mind-body recovery process?
I think we've covered it pretty well. Um, I will say that the emotions are probably the most difficult because when they are being expressed only via the body, how are you supposed to know what that emotion is? And it's not always anger, but anger is probably the most common. And the most difficult of all is anger at somebody that you care about. And it's important to acknowledge that you can have both anger and positive emotions about someone who's important to you at the same time. And that's why writing the letter where you put both the good and bad down is so important to give, all of that um, a chance to be put into words.
Yeah,
Uh,
to give the symptoms a voice. Mm. That's fantastic. And I know people will have lots of questions for you as part of the Q&A, so we'll be able to hear more insights. But we'll give your voice a rest for now. Thank you so much for that. Just, personally, as somebody who read your book during my recovery, and your words helped me so much. And then also just, you did such incredible work in this space. So thank you so much for that. And I'm going to hand over now to Vanessa, who's going to take shares from our recovery team on their lived experiences of overcoming stalls. So thanks again, and over.